Intrinsic severity of SARS-CoV-2, Omicron BA2, the stealth variant, in uninfected, unvaccinated children, a population-based case control study on hospital complications. So this was a population-based study where they retrieved data from the HK, Hong Kong Territory-wide CDARS database of hospitalizations in all public hospitals and compared severe outcomes of the Omicron BA2 dominant fifth wave. N of 1147, prior SARS-CoV-2 variants, 1st of January 2020 to 1st of November 2021, N equals 737. They're also looking at influenza and para-influenza. I'm going to not focus much on that. I'm going to focus on comparing the COVID variants. They reported a higher in-hospital case fatality rate for Omicron than other SARS-CoV-2 variants. The pediatric ICU admission was higher for Omicron than other SARS-CoV-2 variants with an odds ratio of 18.5. So almost 20 times more likely to end up in the PICU. And the proportion of neurological complications was at almost 15% for Omicron. So at least in the data we're seeing here, the intrinsic severity of the Omicron stealth variant, it is not mild as evident by the fatality and severe complications in uninfected, unvaccinated children.
I think that's very important to point out because I can point to you a number of papers where they say Omicron is mild. And I think, as you said earlier, it depends who you're looking at, right?
Mm-hmm. I mean, what makes Omicron mild is being vaccinated.
Yes, absolutely.
Yeah. And I think this is tough. I mean, I know here in the United States, the number of children dying per day has finally started to decrease, so that's encouraging. But I'm going to be doing a call. It's actually later tonight when we're recording, but it'll be early in the morning in Hong Kong. And it's with some of my colleagues there in Hong Kong taking care of these children. Really, really upsetting what is going on there. One of the issues that hopefully I'll be talking to them about is one of their policies is when parents come to the hospital with their children, there's a separation of the child from the parent. And a lot of parents do not want that, so they're staying home. And unfortunately, the stories they're sharing is parents showing up a little too late when the child has already died. So I think when people are looking at vaccination in young people, this is my opinion. I'm making an opinion. I try not to make opinions, but maybe I'm saying the science would suggest that you don't just look at one-time risk. What's the risk of a child getting infected once and the complications? Hopefully, this is a lifetime risk. This child is going to grow up, potentially have repeated infections. So you want to say, is the one-off risk associated that you see with the vaccine series versus the multiple risks every time a child might get infected? The science really suggests vaccine is always the safest choice.